Welcome to the Taking Care of Tutu podcast. I'm your host, Meg Obenow, and today we're so happy to have Scott Corderman on the podcast. He works for Kaiser Permanente, and he also is a volunteer with the Alzheimers Association. Thanks so much for joining us, Scott.
Thank you. Thank you for having me.
So can we start with what you do for Kaiser? You're a nurse, is that right?
Yes, I'm a registered nurse, and I work with the vulnerable population. This is mostly the Medicare, Medicaid population, and do coordination. So coordinating services for people who are at risk for injuries or illness in their home, and putting in services that will help them remain at home and remain safe. So like
Hey.
home delivered meals, the Lifeline emergency button, if they need a nurse aide coming in helping them, if they need help with chore services, if they need help with shopping and errands, or even adult daycare, adult day health. And we put in those services to ensure that they stay safe and they're getting the services they need to remain healthy at home.
So the audience for this podcast is would be primarily seniors or people who are caregiving for seniors. So if they had a parent, let's say the person who's listening to this had a parent who was on Medicaid, would that be something that would come to you potentially?
Yes, and actually, any of the Quest health plans do have similar options. So if they have a family member, if they themselves are on a Quest plan, you can reach out to your plan carrier, customer service, and ask them for health coordination.
Great.
And the different levels of care coordination depending on your needs, all the way from just getting that extra guidance for your medical cares to services in home.
So let's talk about sort of the lower end of what they would need, like the lower ends of like someone who would need fewer services or a little bit less help, meaning someone who just is starting to maybe have a little bit of a hard time keeping track of their different appointments, or it's starting to just seem a little bit confusing. Is that maybe an entry point where your office could start to come in and assist them?
Yes. And what they can do, so help track them, make sure that if they have questions, any medical system, it seems like, people can get confused. And this will be a nurse or a social worker assigned to you, and they can help guide you. If you need, I need an appointment for such and such, they can help get you make that appointment. If you need transportation to get to the doctor, we can arrange that so you can get free transportation to the doctor and back. Now, let's say they're not on Quest. I know, like at Kaiser, there is social workers at clinic. So if they're not on Quest, they're social workers, same thing. And assist with that. And also help with if they need some life planning, like advanced healthcare directive. And getting that advanced healthcare directive, especially at any point, people should have that. It just says if you're not able to direct your own care, one, who would you like to have direct your care for you? So family member, friend, whatever. But having that name down and having it notarized so it's legal. We recommend as an adult, every adult starting 18 should actually have that, because
I agree.
If you're in a car accident, even, you think, oh, what if I have a stroke or something? But it could be anything. And if you're not able to voice your opinion, somebody else can state it legally. And then you can also put in there if you want CPR or don't want CPR, if you want tube feedings or not. And if there's anything special that they want in there, some people say, like, I do not want my sister so-and-so to make any decision for me. Or
Yes.
some people are very specific like that because of some philokia going on, like in families. And
Yes.
it's important for some people to actually direct that out. Some people I've seen put in there, they want their body specifically donated to U of H for research.
Yeah.
And they
Yeah.
put that information in there. If anybody has any um, like ritual or religious type belief that they want people to follow if they are injured, ill, or deceased, some people have very specific things, and that can be put in there so that your wishes are protected. Then we also just gave in the fall of 2024 here to Hale Mahaolu an
Mhm.
$80,000 grant
Wow.
to provide respite care to people with any form of dementia.
Oh, I didn't know that they did that there.
Yes, so Hale Mahaolu actually has a personal assistance program also that they have nurses and nurse aides who, um, and primarily a lot of their clients are in one of their Hale Mahaolu housing units.
Right.
And a lot of their clients, but now with this grant that's opened up and now they are working with people who are specifically have any form of dementia that the caregivers need a little break.
Great. Oh, that's great to know. I didn't know that they offered any of those types of services there at Hale Mahaolu.
Yes, yes, they do. And in fact, the Maui Adult Daycare, the main location is at Luana Gardens, which is a Hale Mahaolu property.
Got it. Got it.
And actually, a lot of the aides that work at adult daycare, it's two separate programs, but they've been moonlighting and picking up some extra just to help out with some respite care.
Right. Makes
Uh,
sense.
so, and then from the 2024 walk, we raised $119,000 this year. I'd love to get people involved with the walk. We have a lot of fun. We have it at the mall. We used to have it out at the Boys and Girls Club, and after the
Yeah.
switched it over to the mall because we had to postpone it, and then we couldn't get it in December when we wanted it in 23. So we had it at the mall, and everybody said, "Oh my God, we love it here." And
Oh.
I think over 450 walkers, um,
Wow.
live music. There's a local band, Kui Kava. They are our grand marshals. This is not I think the third year. This is second year they were our grand marshals. Now this year is their third year, and they play all local. There's three local boys, and they do an excellent job. We had face painting. We have vendors there. We love our sponsors too. If you know anybody who's interested in supporting the Alzheimer's in the community, if you're going to support something local, this is a great way because we put all the money back into the community.